say before I ask for any questions, and I failed to say this. Actually, the ACA, because of the ACA, the Lehigh Valley has directly benefited in terms of our community health centers because of the endowment. The Lehigh Valley has. Our health centers have grown. We have the health center here in Allentown, but we got the new access point in Bethlehem, and we recently, as of a couple weeks ago, got announced for the new access point in Easton. So our medically underserved areas and those that really are struggling to access health care are now going to have at least 2 additional sites in the Lehigh Valley to be able to access health care. And I truly do believe that that has a direct link to the ACA and the efforts of the administration that is currently outgoing. So with that said, if there are any questions for Senator?
Sam Kennedy, reporter from the Morning Call. I presume you're having a conversation with Senator Toomey. I'm wondering how that's going.
Not lately. Not lately. Look, this is a fundamental disagreement. And we're going to be at odds on this for a long, long time. As simple as that. We work together on a lot of things. No one works harder on being bipartisan than I do. Got a lot of patience. I like to get to know people on the other side, listen to their point of view, try to work with them on legislation. I've certainly done that with Senator Toomey. But I am not going to have a discussion with people who are trying to repeal this. We're going to fight them, and fight them, and fight them. Now, look, if they came out, what they could have done is they could have said, you know what, we've had this big debate about health care. One side wants to keep it and improve it. The other side wants to repeal it and I don't know what, but that's been the basic debate. They've had like 60 votes to repeal it, right? 60 times to repeal all of it or some of it. So there's basically a divide here. What they could have said was, if I'm a Republican, they could have said, look, our candidate won for president. We got control of Congress, both houses. So they have total control right now. They could have walked in the door and said, well, we had this debate, so let's sit down and figure out what areas we can agree to change. So we make sure no one loses their health care that has it now, but also make some changes. But we'll give ourselves a deadline, and if the negotiations don't yield any changes, we'll vote on repeal a year from now, or 18 months from now. Now that would have been a reasonable way to approach this. Then we'd be having conversation. But when you walk in the door and say, I want to tear this out by the roots, and let's have a discussion, my answer is no. No. We're going to fight you on this. We're going to try to defeat you on this. And then we'll see where things are after we have a big, big fight. But look, this is America. We have fights about big issues all the time. There's no common ground here. They want to repeal it, and we want to preserve it and fix it. There's no common ground. So I'm not going to pretend like we can work something out here. This is going to be a big fight, and it should be a big fight. And as I said, they should think very carefully before they cast their votes on repeal. Some of them already did on a procedural vote, which, by the way, is a fiscal nightmare, what they're using. They're using a budget resolution, which is not paid for. So if you want another $2 trillion to keep down our debt, vote for the repeal vote. That's a side issue. It's a fiscal disaster, in addition to being wrong. But we'll see where things end up. But for the short term, this is going to be a big, big fight, and it should be. It's about something very, very important. And I remind folks that live in Lehigh County, you know, in our state, we've been traditionally a strong manufacturing state, but that's obviously declined over the last generation. Our state has about 10% of our workforce, according to Department of Labor and Industry 2015 numbers, 10% in manufacturing. Guess how much is in the category called healthcare and social assistance? 17.5%. So it's the biggest job sector. If you list like 20 sectors of our economy by job description, healthcare and social assistance is about 17.5%. Guess what it is in Lehigh County? It's about 5 percentage points higher. It's like 22.5. So the healthcare workforce in this county is about 40,000 people, according to the Labor and Industry. So It's a big industry in our state. It is disproportionately larger in Lehigh County, just like it is in my home county of Lackawanna. So this is, Antoinette was talking about the economy, this is a big economy debate as well. Because if you start devastating and slashing Medicaid, I would call it destroying Medicaid based on what they want to do. You're going to be hurting the economy, you're going to be hurting small businesses in the middle class, but you're obviously going to be hurting people that are vulnerable.
Senator, what's your gut feeling here with the Republicans controlling both houses? Is there any hope for the Affordable Care Act kind of staying as it is, or do you think it's a done deal that it's going to be repealed at this point?
Well, look, they're going to try to have they're telling us that they're going to have a vote eventually. This isn't the vote that they had the other day that they've got to do a couple of steps here. The first vote is kind of symbolic, but it gets the process started. But then they have to, what they're doing now is they're instructing committees to come up with legislation to do the actual repeal. But what they're telling us is, we're going to repeal it, but then they're going to delay the implementation of it for, I don't know what, they haven't told us, 2 years, 3 years, whatever it is. We're all supposed to be, okay with that. The problem is, the New York Times said it today, that healthcare experts have said, you pass repeal, even if you delay it, you're going to create chaos and uncertainty. The last thing we need in the economy that doesn't need any more uncertainty. So that's what they're telling us. But if they were serious about health care, their party, and if they were serious about fixing the Affordable Care Act or doing something in place of it, if they were really serious about that, why 7 years after 2010? Remember, this thing passed in March of 2010. We're almost 7 years. March will be 7 years exactly. After 7 years of complaining about this and denigrating it and not acknowledging any progress, choosing to ignore the 20 million people who got health care. After 7 years, they have no replacement plan. They have zero when it comes to replacement. And here they are on the threshold of repealing it and saying they're going to replace it, and there's no replacement. They're not serious. That is not a serious commitment to health care. If they were serious, they would have had a replacement plan years ago. But certainly a year ago, or at least maybe a couple of months ago, when the election was over, but they don't have a replacement plan. So can we really take them at their word? And then they go around saying, well, we're going to preserve the protection for pre-existing conditions. And we're going to preserve the provision that allows a young person to stay on their parents' land at the age of 26. And we're going to preserve some other protections, so don't worry. But we're also going to get rid of the individual mandate. That's a lie. Okay, there's no other way to describe it. I'm not going to candy coat this. If you say you're going to keep those protections, you have to be able to pay for them. You have to be able to make the math work. Okay? And if you say you're going to preserve those and get rid of the mandate, you have just lied to the American people over and over again. So let's not kid around about what this is. If you're serious about health care, one of the reasons it took decades to get to the point of being able to give 150 million Americans all these protections and millions of others health care itself, one of the reasons it took 50 years or 75 years, depending on when you start counting, whether you start with Teddy Roosevelt or Harry Truman or Lyndon Johnson, this took many, many decades at least, because it is complicated and it's difficult. And what we did in 2010 was not perfect, but it was a lot better than what we had, which is if you're paying your premiums and your child has a pre-existing condition, tough luck. That's the system we had before. And that has nothing to do with the exchanges. That has everything to do with the people that Antoinette just talked about. Half the population in our state, as she said, have pre-existing conditions. And they're telling people that they're going to keep protecting those people. And they cannot do it. And they know that, or they should know it. So they're either lying to us, or they really don't know what they're talking about. It's one or the other. There's no third choice there. Yes?
Yes. Robert Troutner from Let's Build a New Allentown Together. Would you have any idea, do you have any contact to know where Charlie Dent and Matt Cartwright are on this issue?
I have a strong suspicion that Matt Cartwright will vote against repeal. I don't know about Charlie. I haven't
Senator, we have to start the
I
roundtable
know
so
we
you
have
can
to
hear
start.
from everybody, so those of you who
Thanks,
are
everybody, for
joining
your
us for the
time. I'm
roundtable
grateful.
is in the other room.